Hi, I'm Paris, and I finished my last cancer treatment 6 months ago, which is a great thing. However, I haven't finished all my treatments because now I'm receiving a treatment for the side effects caused by those cancer treatments. And this has led me to reevaluate which side effects were caused by which treatments. Originally, I blamed everything on chemo because chemo seemed to be the most fearsome treatment I was going to receive, at least by reputation. And it was certainly tough going through it. But after chemo came radiation and more different side effects. And then after I'd finished the chemo and the radiation more than a year, I still had both some physical side effects I noticed, but in my blood work, some numbers were off. And I thought, well, I wouldn't think the chemo would still be doing it at this time or the radiation. So, aha! I've been on Lupron since the start of treatment. I didn't think too much of that beforehand, but it brings your testosterone, in my case, down to undetectable. And having that be the case over years, that can do a number on your system that shows up in your blood work as well. So most recently, it's been Lupron that I've been blaming for my blood work numbers being off. But as I mentioned, haven't had any cancer treatment for 6 months now. Lupron was the last one to finish. And at this point, my most recent blood work, my testosterone is back up in the normal range. But a number of my other blood test results are still outside the normal range. I thought once I was off the Lupron, testosterone came back up, everything got back in balance, I would be back to normal, but I am still abnormal. And so thinking about it now, maybe chemo really does deserve some more of the blame. Now, some of my blood work numbers have improved, especially the anemia that I have had for 3.5 years since starting the Lupron and the chemo at about the same time. Now, my numbers got to the point where I had moderate anemia. It was bad enough that just walking half a mile on the level ground, I could feel it. That was while I was doing the chemo, so I believe that was a function of both the low testosterone, which has a known effect of reducing your red blood cell count, and the chemo. So after the chemo finished, my anemia improved to being mild anemia, where it spent pretty much most of the last 3 years. I can show you that here, my blood test results on my phone, which gives me the historical listing of them as I scroll up and down. Here's my hemoglobin history. This is the most recent. Let me scroll to the bottom here and go back to the start right before my treatment. October 23rd, 2020, I was actually in the normal range. Soon after starting chemo, you can see it jump down. Popped back briefly into normal, went lower, got down to 10. That's getting low because once you get to 8, that's when they consider putting you in the hospital and giving you a transfusion. But okay, that was the end of my chemo right there. We came up to 11. Notice here, December 30th, 2021, 13.4. Looks like things are going in the right direction, but then it drops back down. I'll tell you in a minute here what happened the end of 2021 that makes me even more sure what was affected by the Lupron keeping my testosterone low. Okay, so remember that. December 30th, 2021, and then we're down in the 12s and the 12s, and then we come back up here. Since you notice there the November 10th, 2023, that was about when my Lupron started wearing off. Came up to 13, came up to 13.3. I'm hoping in another 3 months when I go back for blood work, I'll be back in the normal range. So what about that December 30th, 2021 blood test? Well, my Lupron shot the end of September 2021, they messed up somehow. Still don't know what happened. I think they may have given me a 1-month shot instead of a 3-month shot. But it was also a weird injection because the woman said, oh, you're bleeding as she was giving me the injection. And she grabbed some tissues and continuously wiped while injecting. And I was thinking at the time, how much of this coming out is blood? How much of this is just the Lupron coming back out? She didn't seem to be concerned about it. So maybe most of the Lupron just came back out because she hit a vein or something. They do give you that Lupron shot in the butt. So it's hard to monitor what's going on back there. You have to trust that they know what they're doing. But something went wrong, and my testosterone by the next time of my blood work after 3 months, which was that December 30th, 2021, my testosterone was almost back up to normal from being down to almost undetectable. So something went majorly wrong. But it is informative in as much as the numbers on my blood work that changed that time and changed again now that my testosterone is back up to normal. If it happened just once, it could be a coincidence, but if it happens twice, it's pretty likely I know what the cause of it is. It was the Lupron being on it, being off it, being on it again, and now being off it again. So my anemia is easing up. I am thankful for that. It is what I expected, because the last time my testosterone came up, numbers went up. This time it happened again. My concern though is with some of my white blood cell numbers. Let me just go ahead and show you my CBC blood test numbers briefly here and which ones are concerning to me. This is blood work I did a couple weeks back, May 17th. You can have a look here. And this, not this LY, this is the LY, the lymphocyte percentage. There's another one further down here, yeah. I guess it's not a hashtag, must be the total number. This one has concerned me for a while. Let me go back here to the very start of treatment. Okay, October 23rd, 2020. Before my first treatment, I was at 1.2, which it immediately dropped once they started both the Lupron and the chemo. And you can see, bounced around here, stayed low, got really low here in July of 2021. This is right after the radiation finished. So we have a few months there of it being low. And then it came up to 0.7, which is still pretty low, but it was very consistent after that. 1.8, back to 0.7, 0.7, 0.7. So this one, I figured it was the Lupron keeping it down. But here we are. The Lupron started wearing off back November 10th. And it was most of the way, well, 2/3 of the way up to normal on February 16th, back up completely normal now. What happened to the numbers? It's gotten even worse. Another blood component outside the normal range are my platelets. Now, earlier in my treatment, they seemed to be fine, and I know that's a concern with chemo, that it can knock your platelet number down and then they have to give you platelets, but I didn't have any problem then. Why am I having a problem now? Let me show you. Here's my platelet count. This is my most recent blood test, and I'm down below normal as I was back in November. But let me go back here 3.5 years through the results to show you. I started out fine in the normal range, even early in the chemo. Actually, most of the way through the chemo, I'm looking okay. It wasn't until the chemo finished here in February 2021 that I finally dipped a little below normal. And then we had some more below normals here, down all the way to 103 in August. This right here from April, July, that was when I was doing the radiation. Could that be related? Possibly. Okay, some more low ones. It looks like maybe it's going to come back up to normal. And okay, looks like whatever was causing it has worn off, so I wouldn't think it would be related to the Lupron at all. Except here, the last 6 months, how am I back to being so low again? Could it be the chemo? Yes, the chemo gets into your bone marrow. That's where blood cells are produced, and it can mess with stuff in there. So it could be a long-term, possibly lifelong side effect of the chemo in my bone marrow. It could be the radiation as well, because of the location of the prostate and where they did my proton radiation. I don't know exactly, but it seemed to be off to the sides of the hip. So I imagine at least some of that radiation was going through the hips, the bones, and your hips is your largest source of bone marrow. So it could be the radiation did something. Could also be not that it was a cancer treatment, but when I did the chemo, my first infusion, a few days later, my white blood cell count dropped way down, and they were concerned. They put me on antibiotics, were concerned about infection, and each infusion I had after that, they gave me this thing they stuck on the back of my arm that would activate like 48 hours later. It would just wake up. It would start injecting a medication called Neulasta, which was a bone marrow booster. It would go into the bone marrow and tell it to work in overdrive, producing white blood cells, so I wouldn't see that dangerous drop in my white blood cells. That could also, I imagine, have done something by going in and affecting that bone marrow time and again and again and again. So my next visit with my medical oncologist, I'm going to ask some questions about this. Does this normally happen to people? Is it a lifelong thing? Is there something that can be done to get these blood work numbers back in the normal range? However, I don't really want to hear that, oh, well, we can stick some more auto injectors on you and they'll pump stuff into you. And I'd prefer if it wasn't some strong medical treatment, something more natural and lifestyle related. Is there something I can be doing that can help to get these numbers back? Do I just have to wait it out? Is this just how it's going to be? If I get answers to this, I'll let you know. But for now, I'm thankful to have my testosterone back and my anemia improving. I really feel it. Also, that my PSA continues to behave itself. So thankful for all those things, and I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. Paris TX.